落會我
嚇，
你講
方方醫生落嚟嘅，或者都方方醫落嚟。如果個人個 link 喺邊度咧？係咪要識教咧？咁佢一入去就係嘅，呢個。
做整咁，而家得，而家冇聲。
OK，我 share 呢個先邊。係啦，咁然後我講。So welcome to this mod lecture. I am Charlene Nam. I'm one of the faculty member in the Department of Psychology. I'm also a clinical psychologist by training. So a lot of my research I focus on fear and anxiety, and that's something I want to share with you today. Okay. You can see. So thank you for answering that question. And let's see what you guys are afraid of. Okay. We should have a word cloud. Okay. It's coming. No, it doesn't show up yet. Yeah. Okay. Yeah. So so a lot of you are afraid of insects. That's the biggest one. Some of you are afraid of exam. Some of you death. Yeah, that's a very existential crisis. I saw a patient recently who told me, yeah, I'm worried about that. Yeah, but that's a worry that we need to worry about at times. So my mom, that's that's a good one too. DSE and what else? He's not listening to me. Yeah, being hatred, cannot sleep, fail in DSE, academic result, humans. You are afraid of humans. Yeah. Some of you are afraid of cheese, snake. Okay, that's interesting. A student of mine is afraid of fish. So especially goldfish. Yeah, so we have all kinds of different phobias and anxiety and worry. So thank you for your sharing. So we'll talk about, we can go back to the PowerPoint slide. So that's all your worry and anxiety on the screen right now. So I'm going to talk about how we look at fear and anxiety from a more scientific perspective, particularly from psychology or from the lens of neuroscience. Okay, thank you. Thank you, Awa. Use it how you go. Page up down. Okay. So a few years ago, I saw this picture online, and then it readily captured my attention because you can see from the facial expression of this large rodent. Yeah, it's a, yeah, right there. How do you describe his or her emotion? Surprise, right? What else? Startle. Yeah. Very afraid or fear, right? Yes. So this picture won the Wildlife Photographer Award of the Year in 2019. So it's a very good picture, but it captured the emotion so well, particularly fear. You know, fear is one of the most powerful emotions, I have to say. It has a very strong effect on our mind and body. So what we are going to talk about today in this about 13 minutes, we will go over what are some of the fear-related and anxiety disorders in the mental health world. How do we study fear in psychology and in neuroscience? And I will talk about some neural basis of fear learning in human. So fear, a lot of us are afraid of fear, the word itself, because fear has a lot of negative connotation, right? But fear itself can be a very adaptive emotion. Fear can create a strong signals, usually bodily response or psychological response. So when we are in danger or when we perceive that the situation is dangerous, this emotion is very helpful for us. It prepares us to flee, to fight the enemy, or to flee to get away from the situation, right? And we live in a common fear nowadays, right? We have a common fear in our time, the fear of COVID-19. So according to a recent population survey done in Hong Kong, there are 2 years ago around, right, in May 2020. So they interview around like 5,000 Hong Kong adults. And then they find that the level of fear was about moderate, so 6.3 out of 10. And guess who experienced greater fear? Being females, younger age group. So I think some of you are in this age group. People with lower level of education. And if you live with more people, basically more cohabitant, then they experience a greater level of fear. So far we have talked about fear so far, right? So what about anxiety? So how is fear different from anxiety? In daily life, we use the two words interchangeably, right? I'm afraid of something, I'm fear of something. So we use like this, it's like an overlap, they are synonyms, right, in daily lives. But in psychology, they have different meanings. So a lot of times fear, when we talk about fear, it's really about something very imminent. It happens like right in front of you. If you see a lion right in front of me, then I am feared, right? But when we talk about anxiety, it's something about the future. It has a future orientation. For example, you worry about your exam result, then that's an anxiety in our lens. If you are worried about your mom, that can be fear and that can be anxiety too, right? Because if your mom is right in front of you, then it can be a fear scenario. But if you also worry how your mom treat you, or then it can be something about anxiety. So one important thing in the mental health field is that fear and anxiety, they do not last for a long time. If they usually come and go, if they last for a sustained period of time, and the intensity is very big, it's deep, then it might be not an adaptive fear. We call it an maladaptive fear or anxiety. So, and also if that level of fear or a long period of fear and anxiety interfere the way you work, you study. For example, you can't go to school anymore because you are afraid of certain scenario at school, then that causing some interruption to your daily life, then we call it a maladaptive fear. Okay. So pathological fear or maladaptive fear can lead to common mental health problems. For example, different kind of anxiety disorder, some post-traumatic stress disorder. It all consists of certain kind of pathological fear in it. So the prevalence of anxiety disorder is around 11.6% worldwide. It's quite common. So together with anxiety, anxiety together with depression, we call it a common flu in the mental health field. So, you know, cold or flu, we experience it quite easily in the physical realm, right? But for psychology or mental health realm, it's really about anxiety and depression. Those are very common. So in Hong Kong, is this population-wide survey, epidemiological study has been conducted about like 10 years ago, right? 2010 to 2013. And I captured one of the figures for your reference. So something I would like to draw your attention to is first, female are more vulnerable to having anxiety disorder diagnosis. Okay. Second thing, younger people. So including some of you in this room, right? Had a higher prevalence of mixed anxiety and depressive disorder. Okay. Also, older people, they have a higher prevalence of a generalized anxiety disorder. Okay, so from a more epidemiological and population perspective, the younger age group, adolescents, also young adults, and also the older age group, the older adults, they are really some of the targets that we need to focus when we talk about population level-wise psychological intervention or treatment. So other than generalized anxiety disorder, there are also different other types of anxiety and fear-related disorders. So as a clinician, we usually diagnose mental health diagnosis according to a reference guideline, right? So in psychology, we use DSM-5. So the full name is Diagnostic and Statistical Manual of Mental Disorder. It's developed by the American Psychiatric Association. So it's the 5th edition right now. So some of the anxieties included below are social anxiety disorder. So if you have a fear of particular social situations, or if someone is very frightened in a public speaking scenario, then that can be a symptom of social anxiety. Okay. Specific phobias, fear of heights, fear of spiders, fear of snakes, fear of insects, right? Those can be classified under specific phobias. Agoraphobia. Agoraphobia means fear of open or enclosed spaces. So some people are very afraid of being trapped in a classroom, in a very tight space room. Some people feel very trapped in a tunnel. So they can't take public transportation, for example, to cross the harbor tunnel. So that can be a case of agoraphobia. Panic disorder, fear of having panic attacks. So panic attacks are a very sudden surge of discomfort in your body. Imagine you run 10 flights of stairs, like in 5 minutes. What kind of physical experience do you have? You usually will like shortness of breath, right? Heart palpitation, so your heart racing. Sweating, right? Those kind of sudden feeling can make you feel very uncomfortable. And if this very uncomfortable feeling occurs in maybe a very short period of time, then you might have some experience of panic attack. So usually in those scenarios, it's absent of any dangerous situation. So you might experience panic attack suddenly when you are sitting in a class. Then you suddenly feel that very uncomfortable experience. Then your mind will usually think about two things. Am I going crazy, right? Or am I having a heart attack or some kind of serious illnesses? Or you will be very afraid of dying. So am I dying, basically, you will ask, right? So this type of condition, we call it, will help sustain the panic cycle. And if the panic attack comes quite frequently, then it will develop into panic disorder. So separation anxiety is more a childhood phenomenon, meaning the kid is very afraid when the parents are away. Generalized anxiety disorder means excessive anxiety and worries in daily lives. Okay. And also post-traumatic stress disorder is also related to fear in the DSM-5. So coming back to psychology, much of what we know about fear and anxiety comes from animal studies. And these are the animals being examined in a laboratory. So you can look at what have been examined before. Pigeon, dog, cats, those are being used to study fear and anxiety before. Nowadays, it's more common to use rat and snail. And also look at the right, the picture on your right. Yes, it's your right. Crab and octopus. Yeah, we also study them in an experiment and see how they acquire the fear learning and how their fear can be modulated. So I think in a Chinese context, I find it really, I find it very ambivalent, because think about your hot pot dinner. Do you have crab? Yeah, you have crabs, right? And you also you have octopus, right? We eat them, but then they also have fear learning. So yeah, that made me feel very uneasy when I think about it at times. And we also have this is Eric Kandel. Do you know Eric Kandel? He is a neuroscientist, a Nobel Prize winner. So his study is mainly on the fear learning and memory in this animal, sea snail, and he got a Nobel Prize. So back in humans, one of the very famous human studies is called Little Albert. It's a study conducted by Dr. John Watson in about like 1919, early 20th century. So I'm going to tell you a story about how this little Albert acquired fear in a lab setting. And there's a very nice comic illustration by this, also a neuroscientist himself, Matteo Foriana. I hope I correctly pronounce his name. But anyway, let's see how little Albert acquired fear in the lab. So first of all, he placed little Albert in the middle of the room with a white laboratory rat. So Albert continued to play and then reach for it without fear. So basically, he enjoys playing with the rat. But then Dr. Watson began making a very loud noise behind little Albert by making a very loud noise with a hammer while showing Albert the little rat. So after a few repeated loud noise and praying, little Albert cry whenever he see the rat. So and he see the rat and he would cry even without the loud noise. Okay. So in other words, Albert acquired fear through this conditioning, through this pairing process. So we are not sure whether little Albert's fear towards the rat was ever removed after the session. Nowadays, we cannot do this kind of experiment. It's not ethical at all, right? But Watson's finding is very influential. The most influential thing is he has shown that fear can be learned. It might not be innate, but it can be acquired at some point in your life. Okay, so that's the story about little Albert. And nowadays, how do we do fear-related experiment in our lab? So we use a paradigm called classical conditioning paradigm or Pavlovian conditioning paradigm. So what do we do? So in a typical setting, we have a neutral stimulus, for example, a square, a geometric figure, or a face, and then we pair it with a very aversive outcome. For example, a very loud female scream, or we give electric shock. So whenever the participants see the shape, then we pair, then he or she will get shocked. Of course, a very controllable level. It will make you feel very uncomfortable, but not to, certainly not cause you to go to the hospital, that kind of level or intensity. So we do see this kind of pairing in a lab. And then generally, we look at the condition response. We look at the fear response. We look at the fear response in certain ways. Number one, we look at their subjective reports. So how do you feel about this shape after this pairing? And we also measure it through different kind of physiological response. For example, we can do skin conductance. So these are the two electrodes attached to the fingers, and we measure the conductance of these two electrodes. Why do we look at this? Because when you are afraid, you sweat, and then it will increase the conductance between the two electrodes. So another way we look at condition response is through pupil. So when you are afraid, your pupil response will dilate. Okay. A third way we also do that is put the participant in a scanner, MRI scanner, and we look at the brain reaction. So the guy on the right is Ivan Pavlov. He is a very he deserves a Nobel Prize, I would say, but he doesn't get it. He's a Russian medical doctor. Has a lot of research studies in classical conditioning. So and we should pay tribute to his discovery and his creation, I have to say. So sometimes I like to call it Pavlovian conditioning paradigm because of his contribution in this area. Okay, so let's look at some neural images, the brain mechanism of fear. So at the heart of the fear circuit, one region is very important in our brain is amygdala. Amygdala is a region in the temporal lobe. Let me see. So this area, can you see my, oh no, you can't see my mouse. Then I'll use this one. Okay, so this area is the temporal region of the brain. So amygdala, this is the sagittal cut, meaning you cut it sideways, this way. And then it's located here. This is the coronal cut. You look at the brain from the front. That's the transverse cut. You look at the brain from the top. So it has three orientation for you to locate the amygdala. So amygdala is very important in the fear circuit, and it has three important nuclei: the basal nucleus, the lateral nucleus, and the central nucleus. So the nucleus has slightly different functions. So in a nutshell, so the basal, the LA, the lateral nucleus, receive information from the sensory system and then project it to the central nucleus. And then the central nucleus will project it to other important areas, for example, the hippocampus, the thalamus, and other brainstem region to initiate our condition response, the fight or flight escape response. So this circuit is very well established and studied in the field of neuroscience. So if you are interested in this area, come do psychology and come do neuroscience, then you will know more about this circuit in detail. So one very interesting case in human is called Urbach-Witt disease, UWD. It's a genetic disease. So basically, there's some genetic mutation in on chromosome 1. So what it does is called a bilateral basolateral amygdala damage. So it causes calcification in the amygdala region. So imagine if that region is basically malfunction or is gone in your brain, what will happen in human? This is one of the diseases that show the manifestation of having a amygdala impairment. So apart from some physical symptoms, for example, some problems with voices and some problem with the skin, those patients, they have an impairment in recognizing fearful facial expression. Okay. So it maps to our laboratory study and understanding of the fear in the in neuroimaging and in neuroscience. So so far we talked about the neural correlates of fear and how we study it in a laboratory. As a clinician myself, I'm more interested in how to help my patient to modulate their fear level, right? When they come to me, they usually ask me, okay, I'm very afraid or very frightened in that kind of situation, or I have that kind of worry. Can you help me like reduce the level or modulate it? They don't ask you to, okay, give me more fear or give me more anxiety, right? So a lot of my research, I focus on how the fear extinction circuit more than the fear acquisition circuit, basically. So I asked about how we modulate fear. And then one message you can take home is we talk about amygdala is very important for fear learning, right? For fear extinction, it's the ventral PFC, the ventral medial prefrontal cortex, basically our prefrontal cortex. Up here in this area is very important for modulating our fear. I think that's the message I want to share in this slide. And also from a clinical perspective, anxiety disorders are treatable. So relatively treatable compared to other more serious mental illnesses such as schizophrenia or bipolar. We usually think anxiety disorders and depression are quite treatable, and we have different type of treatment, existing treatment that are useful for modulating anxiety and fear. For example, psychotherapy, mainly the exposure-based cognitive behavioral therapy. It has been it's evidence-based treatment for treating anxiety disorder. And there are also medications that are very useful for modulating the level of bodily fear response. But we face two problems in the clinical field. The response rate is not optimal. So around like maybe perhaps half of the patient, after they receive a successful course of pharmacological or psychotherapy, they experience relapse. So it comes back, right? And then, so I think that's really the problem that we are facing in the field right now. So we have treatments, but the treatment are not optimal. So as clinician and as also scientists, we need to think about how to optimize our treatment. And something we learned so far from in the literature or in laboratory studies is that fear is very easy to acquire, but difficult to forget. Okay, so that's why people who experience trauma. It's always one incident, but it's lifetime. They remember it lifetime, right? So fear is very easier to acquire, but very difficult to forget. Paradoxically, if we want to do fear extinction, modulation of fear, extinction is very easy to learn in the beginning, but it's very difficult to remember. Okay, meaning that it's very difficult to remember what we have teach you in the psychotherapy session. It's very difficult for you to like apply it in daily life sometimes. So that's why the treatment response is not optimal. So can we make extinction learning more permanent? That's my research question basically. And I think in the interest of time, I have to skip a few slides and then move towards the end. So if you are interested, you are welcome to really come to Hong Kong and study with us. And we find a solution to this very difficult, challenging situation that we face in the clinical psychology field. So I wanted to talk about something about consolidation, but then I didn't have time already. So I have to really fast forward. And there are some exciting directions in the field in how to make extinction learning more permanent. For example, there are studies by manipulating the eye movement. Okay, there are also some studies using different type of neuromodulation technique. For example, transcranial direct current stimulation, TDCS, TMS, transcranial magnetic stimulation. Those kind of like technique might modulate our fear circuit and fear learning circuit and fear extinction circuit. And there are also some very, very, very interesting study, I think, bypassing your consciousness exposure, something to manipulate your consciousness and unconsciousness and how to make the learning more permanent. So there are some very exciting directions in the field. And last but not least, other than the clinical psychology area I presented today, there are also other research areas in our Department of Psychology. For example, cognitive psychology, educational and developmental psychology, social and health psychology. I encourage you to go to our website and look into the details of the lab. A lot of us have a lab website, so we can go into that website and see what the PI or the professors are doing. And I think that's all for my sharing today. Thank you very much for your attention. And thank you for coming. FAQ. We have 10 minutes for questions. If you have any, you are welcome to go, because I know your schedule is very busy today and you would like to visit the labs and also all the other departments in the Faculty of Social Sciences. So feel free to go if you don't have any questions. Okay. Thank you so much for coming again.